Well, let's speak about measuring corneal biomechanical changes after cross-linking. My financial disclosure, I'm also very glad and proud to be a collaborator with OCULUS for a few years. And biomechanics in the old days was measuring IOP, then thickness, and then biomechanics, meaning that most of the time we really didn't know what we were measuring. And the first step was having, as Professor Sheikh said, BIOP. Then we created normality values, because that was very important to make any comparison. At the beginning, the way we were comparing patient was getting an abnormal or possibly abnormal patient and matching it with a patient that we knew it was normal with the same IOP and the same CCT. You can imagine how easy it was. Then, as we say, we needed an IOP that was not correlated with biomechanics, and we went through that. Then we got the CBI. We didn't specifically discuss about it, but I know that probably you guessed what it is. And now we speak about cross-linking. So, in the beginning, we were measuring stress strain ex vivo. So we were taking a cornea, pulling the cornea, if it is stiff, if it is soft. Very easy. Unfortunately, in vivo doesn't work like that. So, I'm going to ask a question also to wake you up, and this is by hands. Who is doing cross-linking in patients? Raise the hand. Quite a few. Okay. So who is working with doing cross-linking and working either with residents or very young doctors? Right? Okay. I am sure that then it happened to you that you have done an AP of cross-linking, and then you maybe asked your resident, your fellow, or one young doctor to do the follow-up. And then they come to you and they say, Riccardo, what did you do? They are worse in terms of pachymetry, visual acuity, curvature, aberration. And they come to you and say, Riccardo, what do we do? And you say, don't worry, they will go better. But really, the right answer is in average, we know that they go better, and I hope that they will go better, but you don't know at 1 month. What about the demarcation line? The demarcation line is what we know is that it's correlated with the depth of the death of the keratocytes. This is what is sure. But it is also known that it's not correlated with the flattening effect. So the demarcation line is probably useful, but is not a way to measure the proper effect, so the stiffening. So we should go to basics. And as Yoda is saying, biomechanical assessment we need. So let's try to see if it is possible to see any difference. And we're going to speak about, obviously, the Corvis. Cinzia already went through this. I'm very happy. So we have published 2 studies, and another one is coming. So the first study was published more or less 1.5 years ago. It was a very simple study. So we had 34 patients with an AP-off protocol with progressive keratoconus. We have done an AP-off. We have done Corvis and Pentacam pre and 1 month post. Let's stop 1 second, because we are in a kind of users meeting, or maybe I don't know if I want to buy the Corvis, but what you should know, if you want to measure the effect of cross-linking, you need to do the Corvis the day of the surgery, 1 month after. If you do it before and you do it after, it's much harder to find the stiffening effect, because then you have viscoelastic changes. So I had so many doctors showing results, and then I ask, when did you do the measurement beforehand? And they say 3 months before the cross-linking. But the cornea can get worse in the meanwhile. So if it gets softer and then stiffer, maybe you don't see the difference. So the day of the surgery, 1 month after. The main outcome that was published in Journal of Refractive Surgery, so if you want, this is for free. You just go on Journal of Refractive Surgery and you can download it. As Cinzia has said, stiffness parameter when the cornea is stiffer goes up. All the other parameters, if the cornea gets stiffer, goes down. Does it make sense? We can go through it again. So the idea is, imagine that the IOP is the same. So let's make it simple. If the cornea gets stiffer, it will deform less. Correct? Fine. So if it deforms less, the radius of concavity will be wider because it deforms less. But it's the inverse radius, so it gets lower. And that's the same. Stiffness parameter instead makes sense. So it gets stiffer, goes higher. In the second study, we wanted to evaluate something else. So, does the demarcation line depth, is it correlated with the stiffening effect? Is it correlated with something else? And we slightly increased the number of patients, and we have assessed also the demarcation line. So the main result that we haven't seen any association between the change in stiffness and the depth of the demarcation line, the age, sex, preoperative Kmax, and laterality. But, and this was making sense, if the cornea is soft pre-op, you would expect to get stiffer post-op. If it is already stiffish or not very soft, you would expect to get stiffer, but not that much, which does make sense, and we have seen this in the study. We have acknowledged the limitation of this study. We had a relatively low number of patients, so it would not have been possible to find a small association with the demarcation line, whether present. We had a short-term follow-up, and it would have been possible to detect changes if in the long term. There was a very nice paper by our friend Cosimo Mazzotta discussing about the meaning of the demarcation line, and what they were saying is that maybe we couldn't find this because there is a non-linear association, which we have tested, and we still haven't found it. So I think that the right answer is either not or yes. So we don't know if the demarcation line is associated with cross-linking. There are some hypotheses that are saying yes, but the evidence in vivo are saying no. So I think we should still measure it, but we should not claim that if it is deeper, we are stiffening more the cornea. It is deeper. Maybe we are going deeper in the cornea, but we don't know if the effect is more. But then we say that in the beginning was stress strain. Professor El-Sheikh showed stress strain index. So maybe we want to test it also in cross-linking. Yes, we have the results. So I'm very happy that I don't have to explain this to you, also because I'm definitely much worse than Professor El-Sheikh. So I can just go to clinical practice and show you very preliminary result about how does it work, stress strain index after cross-linking. And also this is a very preliminary result. I'm very proud to be collaborating with a multi-center study with Dresden University. Robert will also show us a clinical study, I believe, later, and with Professor Farah Dafezi from Switzerland. So, first result, you can see the stress strain index, as expected, is increasing pre and post cross-linking. And the nice thing is that this is even at 6-12 months. So there is an increase. It's an unpublished data, but we are getting what we expect. So the stress strain index is increasing. However, you have to remember that even if you do see a difference at 6 months, most of the time if you want to see the real difference is at 1 month. And then the stress strain index and the delta in flattening. So we have seen, as I said, you can see that the points are few. So these are small amount of patient and is not significant. So we might have different results in some months, but it looks like that there is a trend that if the cornea is stiffening a lot, then you have a lot of flattening, which does make sense. We will need to confirm this data with many more patients. Maybe with more patients, we will not have this same result, but it looks very promising. So I'm happy to show you in clinical practice how it works. We have the new software, and this is also coming from a collaboration with Dresden University. We have done a repeatability study because when you evaluate a person, let's imagine that you are measuring my height, and I say I'm 101 meter and 81 centimeter. And you make another measurement and you say you're 1 meter and 82 centimeters. Did I grow by 1 centimeter? No. Most likely you're just making, a slight mistake in the measurement. And that's the same with the Corvis. So to be able to know if it is significantly stiffer or softer, you need to know what is the noise. If I'm doing 2 measurements, 3 measurements, will they all be the same? No, it's impossible. So we have done a repeatability study on keratoconic patients to be able to know if I'm starting from this and I go here, is it significant? Is it more than the noise? And so we were able to create 95% confidence interval. Does it make sense, this concept of the 95% confidence interval? This is crucial. For everybody is clear? Yes, okay. So in the software, there will be the stress strain index with the significant difference. So you have stress strain curve of exam A, exam B, with the value and the standard deviation, and the software will tell you automatically whether it's getting softer, stiffer, or non-significant. And it will be the same also with the parameters. And I will show you like a screenshot how it looks in the big one. You will still have, this is a patient before and after cross-linking. So you have blue before cross-linking, red after cross-linking. You will have the two corneas superimposed, and you can see how they will move. But also the most interesting thing is that you will have, as you expect in this case, you have stiffening of the cornea, stiffening, no change in thickness, which might be significant because they might get thinner, but still that's not a problem. We expect that. And stiffness parameter and stress strain index getting all of them significantly different. It's not always the same. So you should not expect to have all the indexes always significantly different. But even if you have, you know, one or two that is significantly different, then it's still telling you something. So in conclusion, how this comparison display could help? Keratoconus progression, because if it is getting softer, then it's some kind of indication. Post-cross-linking, obviously, post-intracorneal ring segment implantation, after laser vision correction, and the stress strain index, well, we have so many application of stress strain index that is from pre-op to modeling surgery is just a new area of evaluation. Thank you.